which is 3 months' time, that I intend to, and I had a meeting with Amnesty yesterday, which I gave the same commitment, I intend to go behind the figures to see what is the real funding in mental health as compared to 5 years ago. And if the case is sustainable, and I've made it already clear to many groups coming into me, I intend over the coming few months building up a programme for government before the estimates campaign begins to start the campaign to ensure that there be a specific percentage of the national health budget totally earmarked for prevention of mental health. And that's the commitment I'm given here at this conference today, that by the time of the next budget, I will have my campaign begun, hopefully in train, to ensure that. And that will deal with the whole issue once and for all of whether we're trying to divert funding from one sector to the other. I want to go back to some parts of the official speech, because really I think it gives a flavour of the way the department itself thinks, and it's important I should recognise, particularly the people who spend so much time putting together 45 pages of a prepared speech. And I say that with all respect, by the way, because clearly people take this job quite seriously, and I don't want to make little of that. But I think it's important whenever I go to a conference to try to, as it were, recognise that, okay? In the speech, again, is rather than have me speaking off the cuff, it's important I talk about the whole employment control framework and try to bring some bit of clarity to that. I'm going to get a drink of water, folks, so I tell you something, it's... must grant a bit. That's great, yeah, thanks. So again, and I know it's late in the evening, I'll thank you for waiting on, okay? Either way, the Health Sector Employment Control Framework 2010 to 2012 has been agreed between the Department and the Department of Finance and the issue of the HSE. The 2010 framework, similar to the one that operated in 2009, contains a number of grades exempted from the general moratorium, including clinical psychologists, counsellors, of course, behavioural therapists and some other therapy posts. Many of these grades will be found in the mental health service. Again, last year, a derogation from the moratorium was also given for the filling of 23 and 36 mental health nurses at the Central Mental Hospital and the St. Loman's Hospital, Lucan, respectively. Can I just say that, and I just missed that point, it is important to be able to say to you that I had the opportunity to be at my first cabinet meeting some months ago on the basis of trying to ensure we have funding separately from the capital programme to ensure that our commitment given by me last year that we would fund the building of a new central mental hospital. I know that people are going to say, we've heard of that song before. I'm saying the song here again because I've been clear to ensure that working with Brian Gilroy and the HSE procurement side, we will come with proposals to Cabinet before the last quarter of this year. Again, I'm very pleased to inform you that following the consultation intervention, the Employment Control Programme provides for exemption in relation to certain grades in which posts may be filled and new posts created. In order to support the implementation of a vision for change, the first 100 psychiatric nurses vacancies that arise can be filled by psychiatric nurses or otherwise. But the allocation of these posts to particular service locations, geographic areas, will be identified by the National Care Group Lead for Mental Health in consultation with my own department. That's where I referred to a few minutes ago. The initial move will be to provide nurses and care in the Blanchardstown setting. And again, as you're aware, the Health Service Executive operates a sponsorship scheme for eligible and experienced public service employees who wish to train as nurses, midwives. The scheme was introduced in 2002 to provide a career development pathway for healthcare assistants and other support staff who are involved in the delivery of care and patients of the public health service. I'm also pleased to inform you that the Employment Control Framework provides for up to 30 new posts per annum to facilitate the appointment of successful students from the sponsorship scheme. Folks, I don't intend going on to read the rest of the speech. Can I just say this? You know, notwithstanding, and I suppose notwithstanding is a very cute word to try to forget government policy for the last 2 years, but if I could just come back to say that the plea or the invitation, as it were, to work with the P&A within the same tent, well, you know, still stating the obvious point that I'm a government TD and government minister, Fianna Fáil TD, that is my intention, to work to deliver the reform programme Vision for Change. I'll do so by way of promoting the capital programme Community Services. I think it's fair to make the point that it's something that I'm committed to by way of ensuring over the next 3 months. I'll show that will be done by way of, I intend inviting in all of the Oireachtas members to go forward to say how Vision for Change will be implemented over the next 2 years, given the fact that there are some difficulties in some locations throughout. So I want to say a word of thanks for the invitation, and I look forward to, I would hope, I did think I was engaging with the P&A, I hope I am, and I would hope that I will do so for as long as I'm in the department. Thanks.